USMLE style question, work of breathing. Question: a 60-year-old man with a history of chronic obstructive pulmonary disease, COPD, presents with increasing shortness of breath and fatigue over the past several months. He states that breathing feels more labored, especially when walking. Pulmonary function tests show a decreased FE1-FVC ratio, increased total lung capacity, TLC, and increased residual volume, RV. Arterial blood gas analysis reveals a PaO2 of 65 mmHg and PaCO2 of 50 mmHg. Which of the following best describes how work of breathing is affected in this patient? A. Increase due to increased airway resistance, requiring more expiratory effort. B. Decrease due to increased lung compliance, reducing the need for inspiratory effort. C. Unchanged, as the lungs compensate by increasing ventilation efficiency. D. Decreased due to reduced elastic recoil, making breathing more passive. E. Increased due to decreased compliance, requiring greater inspiratory effort. Answer and explanation. Correct answer: A. Increased due to increased airway resistance, requiring more expiratory effort. Explanation: the work of breathing, the B, is the effort required to move air in and out of the lungs. It depends on airway resistance, RAW, resistance to airflow in the bronchioles. Lung compliance, C, the ability of the lungs to expand and recoil. In COPD, which includes chronic bronchitis and emphysema, increased airway resistance due to mucus production and airway collapse makes expiration more difficult, requiring greater expiratory effort. Loss of elastic recoil in emphysema contributes to air trapping and hyperinflation, further increasing work of breathing. Dynamic hyperinflation worsens the problem, as patients must breathe at a higher lung volume, increasing inspiratory effort as well. Thus, both inspiratory and expiratory work of breathing are increased. But expiration is especially affected due to airway resistance and loss of elastic recoil. Why not the other choices? B. Decrease due to increased lung compliance, reducing the need for inspiratory effort. Incorrect. While emphysema increases lung compliance, the overall work of breathing is still increased due to air trapping and airway resistance. C. Unchanged, as the lungs compensate by increasing ventilation efficiency. Incorrect. The lungs cannot fully compensate, leading to progressive hyperinflation and increased work of breathing. D. Decrease due to reduced elastic recoil, making breathing more passive. Incorrect. Loss of elastic recoil actually increases work of breathing because the patient has to work harder to exhale. E. Increase due to decreased compliance, requiring greater inspiratory effort. Incorrect. Compliance is increased in emphysema, lungs are more stretchable, but air trapping and airway resistance cause increased work of breathing. Key learning points. Work of breathing is increased in COPD due to airway resistance and loss of elastic recoil. Expiratory effort is significantly increased due to dynamic airway collapse. Patients adopt pursed lip breathing to maintain airway pressure and prevent collapse. Hyperinflation forces inspiratory muscles to work at a mechanical disadvantage, further increasing WOB. Would you like a question?